My name is Sharice Shimwell. I'm from Guthrie. I highly recommend Dr. David McCord for the simple reason he's one of few who has the patience and understanding of a person who cannot move around without any assistance. He was in the beginning when I saw him in August of '91, when he first came to Nashville. He didn't really think I would ever be able to continue to walk. My doctor back from Russellville, Kentucky, who's deceased now, she recommended me to come to see Dr. David McCord. And I've been proud and glad that I made that decision to do so. As you see, I'm without a walker. I have no wheelchairs nor cane. And it's because of his support that I had and still do. It's been 6 weeks that I've had my last surgery, which was on my neck. And unfortunately, my body rejected 3 of these screws. And that was only February of last year that they were put in. But my body rejected them, and my neck started sinking in. It sunk in so bad that I could take my fingers and just put it down in my neck. That's how deep my neck kept sinking in. And in a 2-week period, from the time I saw Dr. McCord, from a procedure I had done, and the day of surgery, he himself couldn't realize how much it was sinking still. But he knew something needed to be done, and he took care of it. And I am proud to say I have, no objection, a smooth neck now, which I can hold up. I can turn and look to my right. I can look over my right shoulder. And I can do the same way with my left. When I was driving prior to surgery, which I did not realize until my mother and a friend was noticing, I was turning my entire body to look over my shoulder to see if anybody was behind me. But since surgery, January of this year, I do not have to depend on anybody again. And it's all because of the help and support and the faith of Dr. McCord. In August of 1991, Dr. David McCord did surgery on the lumbar part, which is my lower back. And I had a herniated disc. And as he described it, it looked like a hot dog that had been blown out of proportion in a microwave. They tried therapy, physical therapy with me. My mother had to do all the driving for me. I got to the point where I couldn't drive. Muscle spasms constantly in both legs through my feet. I was drawing up. I was sitting in the horriblest positions with legs up, no control over them. Then when it got to the point where I was in a wheelchair, because walking from, I'm gonna say 12 feet, I would fall. And it just got where I couldn't walk. And so my doctor back in Russellville, who had suggested I come here, as I said earlier, and he ran several tests on me. And he did the first case, he did surgery on me then. And then he did surgery again in December of 1993. and he caged my entire lumbar, all of it, and I haven't really had any problems with it. As far as driving, no problem whatsoever. When it comes to walking, no problems. Trying to keep up with my mother and walking, that's another story. But I don't have the sharp pain that I was having. I couldn't believe, I could sleep, didn't have to take no pain medicine. I'm against that, I guess, because so many reactions to medicines I've had. Then I think it was 2003, he did another one. No, not on the lower. It was on my neck then. Altogether, he has done 3, 4, 5 on my neck. 3 in the front and 2 in the back since the 93. And each time, it seemed like I can do a little more better than I could prior to that surgery, that he just put those others in. And then working out the way they were doing, the first thing I would want them to know is he is not one of these people or individuals who wants to take a knife after you. He wants to know every little thing about you. He wants to know about the pain, the suffering, the inconvenience that may be caused toward your family. He wants to know how it affects your lifestyle. And he is one who sits down and listens. Not only when he listens, he makes you feel like you're the only person, regardless how many's out in the waiting room. He gives you that feeling you're the only patient he has today. And just knowing that you can go and talk to him, say, I've got this little problem I'm not really sure about, and I don't know what I need to do. He's willing to listen. To give you an example, prior to this last surgery, I got bit by a blister beetle on the back of my leg. I had gone to the hospital that Monday for my pre-op. Now tell me how many doctors prior to doing surgery would even bother to come on to say, okay, maybe we need to check it out. How many doctors will take the time knowing they've got another procedure to do? But just taking that few minutes and seeing if that's going to have any effect on you having surgery again. And it just, little things like that will stay with you and give you that confidence of knowing he is there for you.